and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terrence Deyalsingh, the Minister of National Security, the Honorable Stuart and the Chief Medical Officer, Dr. Roshan Parasram. The Minister of Health, the Honorable Terrence Deyalsingh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to ladies and gentlemen of the media, all citizens, or everyone in Trinidad and Tobago listening. Good morning to my colleague, the Minister of National Security, and the Chief Medical Officer. My short report to you this morning is going to be a report with a total difference because we are the ministry moving into a different phase of our COVID response. So let me just alert the media and the general public as to what the Ministry of Health is now doing as we prepare for the future. At the ministry, we have taken a decision to start a retrospective study of all 116 cases of COVID in Trinidad and Tobago. What that will do is to help us make plans for the future. It will help us now consider the new symptomology that is presenting itself across the world. One of the newest symptomologies, and the Chief Medical Officer will expand on it, and I'm just raising it here, is something called silent hypoxia. You would have heard last week and 2 weeks ago, new symptoms presenting loss of taste, loss of smell. The Ministry of Health is going to be very proactive by doing this retrospective study of 116 cases so that when we prepare for future developments, we will have a model not only for COVID, but a model as to how future ministers of health, ministries of health, future governments can deal with pandemics. Under that, we are setting up a steering committee chaired by the Chief Medical Officer to start to invite papers. And some of the papers we are going to be leading are: 1, the clinical experience to date; 2, the public health mitigation strategies that have been implemented, and Minister Young will speak to that; 3, the effectiveness of the parallel healthcare system; 4, how did we manage supply chain challenges in light of global supply chain disruptions; 5, the intersectoral response, PAHO, CARFA, the private sector, NGOs; 6, how did we manage communications, trust, and implement behavior change. Other papers will include governance and crisis management and crisis leadership. And another paper will deal with the transitioning from this period of COVID to the hurricane season. These papers are by no means exhaustive, and we'll be reaching out to all agencies and people and researchers to be part of this Ministry of Health very proactive stance. We will include in the steering committee, once persons volunteer, are actual patients. Of the 116 patients, we would like about 5 patients to come forward and give us their experience. But we want to choose 5 patients across the spectrum from mild, moderate, and severe symptoms. You would have heard Dr. West, I think the week before last, give his experience in treating a severely compromised person. The reason for the Ministry of Health taking this lead now is that we have this rich data, clinical data, demographic data. This data must not go to waste, but it must be used for the benefit of Trinidad and Tobago as we move forward, not only to deal with the second or third waves, to predict where the clusters may come from, because we're going to use the data from the GIS mapping system that we have, but it will also inform how future governments respond to pandemics, because pandemics are going to become a feature of public health. So this is a major decision we have taken at the Ministry of Health this morning. We were thinking about it for a couple of days. We have fleshed out certain parameters, and when we have more meats on the bones, we will come back to you. Another paper, most importantly, is the mental health response. You would have heard Dr. Hazel Othello speak about this. This is going to be front and center as we move forward. So, Minister Cox, that is my very short but important announcement this morning, how the Ministry of Health will be driving now research into this issue of COVID, and I thank you very much.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update. Dr. Parasram.
Good morning, honorable ministers, members of the viewing and listening public. My update for Tuesday, the 7th of May, 2020 is as follows. The number of tests conducted thus submitted to CARFA and the UE labs, 2,153. The number of unique patient tests, 1,821. Number of repeated tests thus far, 332. Number of positives, 116. Number of discharges, 103. Number of deaths remain at 8. So in terms of hospitalized patients, we only have one patient at the Couva Hospital at this time. That person is in the HDU. And there are 4 persons in the Home of Football facility awaiting their double negatives for discharge. In terms of what Minister would have alluded to, silent hypoxia, and just a brief explanation of what silent hypoxia is. So the research from other countries have suggested that persons with COVID-19 are presenting a new phenomenon, clinical phenomenon called silent hypoxia. So basically in the past, when you have a respiratory condition, whether it is a pneumonia of bacterial origin, asthma, or any other illness, what you have done when you come into an emergency department in terms of assessment, you would have your pulse oximetry done, which is basically placing a device over your finger, tells you your blood oxygenation level at a glance. Usually in a person on room air, it's supposed to be anywhere between 97–98%. In a person with, for instance, comes in with an asthmatic attack, severe nature, it may go down to something like 87, lower 90s on room air. We put those people on oxygen. For instance, it will go back up. In cases where you have 87–90%, what we see in other diseases, other types of pneumonias, is people are experiencing respiratory distress. And visible signs include flaring of your nostrils, you have increased, your intercostal muscles are being used, you find someone looks visibly short of breath. The phenomenon of silent hypoxia as it relates to COVID seems pathognomic to some extent, meaning that it defines the disease as a clinical sign. What is suggesting is that the level is actually somewhere between 50 and 60% oxygenation, and persons can be sitting around normally, no signs of respiratory distress, using their phones, talking normally, but their blood oxygenation level is far below what we would expect for a person in that sort of non-respiratory distress setting, and that is basically what we are calling silent hypoxia. I think it has been noted in Trinidad in the cohort, and our research will bring out more of that clinical picture when we do so. So, Minister Cox, that is my clinical update for this morning.
Thank you very much, Minister of National Security.
No, CMO.
Oh, thank you much, CMO. At this point, the Minister of National Security, I was thinking about national security next. The Minister of National Security, the Honorable Stuart, will speak on measures taken by the government to protect the population of Trinidad and Tobago and border control.
Thank you very much, Minister Cox. Good morning, everyone, my cabinet colleagues, Minister Cox, Minister Deyalsingh, Chief Medical Officer, members of the viewing and listening public of Trinidad and Tobago, members of the media, good morning. My purpose here this morning is just to take us very briefly through the measures, the most significant measures that the government has taken in our fight against the spread of COVID since January of this year. You all would recall, we the population would recall, that this COVID-19 pandemic, which is global, is really done via spread. The virus is a spreadable virus, and in fact, it spreads by contact. And most importantly, the virus was imported into Trinidad and Tobago, and that's what we've seen globally. So the importation of the virus into Trinidad and Tobago is what we've been combating and what we've been fighting and had some level of success at. thus far, and well done to everyone for following the various measures. You all would recall that it was in January 2020 when we were monitoring the outbreak of COVID-19 virus in Wuhan, China. On the 30th of January 2020, at a post-cabinet media briefing held at the Diplomatic Center, that is when my cabinet colleague, Minister Deyalsingh, announced that cabinet had taken a decision to restrict travel from persons from China. If you had been to China for 14 days prior, we were not permitting you into Trinidad and Tobago. That was on the 30th of January. In February 2020, on the 27th of February 2020, we then went further and imposed further restrictions, travel restrictions, on a number of countries: South Korea, Italy, Japan, Singapore, and Iran. And also at this media conference, what happened is you had national security pledging its support to the Ministry of Health, as we realized that it was only a matter of time before the virus could reach to Trinidad and Tobago through importation. We also, at this time, the Ministry of Health introduced screening at our international airports, and there was a two-tier screening that was taking place of persons' temperatures as they came off, as well as persons being asked questions about their travel. We also announced at this time the launch of our cabinet-appointed interministerial committee, which is chaired by the Chief Medical Officer and has a number of different divisions and personnel on: the Chief Immigration Officer, Ministry of Foreign and CARICOM Affairs, Chief of Defense Staff, Commissioner of Police, Ministry of Education, Ministry of Trade, and other bodies that we felt necessary to start looking at and planning and advising us on the measures. This committee, chaired by the Chief Medical Officer, was to report to both the Minister of Health as well as myself as the Minister of National Security. It was on the 12th of March 2020, in between there, we also added some further countries, some European countries, and travel restrictions to those European countries. And then on the 12th of March, at a post-cabinet media briefing, is when we announced that we had decided to suspend all cruise ships docking in Trinidad and Tobago. We also advised the population to avoid non-essential mass gatherings in public places as a precautionary measure against COVID-19. And we also announced on that day, the 12th of March 2020, that government would only be authorizing emergency travel for public workers at this stage, and we advised members of the public, including athletes and sport teams, to refrain and only engage in non-essential, non-emergency travel. It was later that day that we then had cause to have a second press conference because Trinidad and Tobago had its first positive case of COVID-19. On the 14th of March, we then came and announced that we would be closing schools for a week. On the 16th of March, we announced to the country that we were aware that we had 70 nationals on a cruise ship in Guadeloupe, and we were in communication with them and awaiting the French authorities to allow their release. And preparations began with the Ministry of Health, Ministry of National Security, to deal with these nationals upon their return from that cruise in Guadeloupe. On that day, the Prime Minister also announced that as of the 17th of March, midnight, we will be restricting entry into Trinidad and Tobago, and no non-nationals would be permitted entry into Trinidad and Tobago. Ladies and gentlemen, all of these measures were designed to protect you, the population, in Trinidad and Tobago, because it was obvious that the importation of the virus, the first case, as you will recall, was someone who had traveled to Switzerland and made their way back here. So the cases were imported, brought into our borders. So those are some of the travel restrictions we took. And then on the 17th of March at midnight, we closed our borders to all non-nationals. We continued. We would allow cargo ships to dock, but the crew would not be allowed to disembark. All schools and learning institutions were to remain closed until the 20th of April. The population was advised to desist from participating in public gatherings of more than initially 25 persons. We said that all bars and restaurants were to remain closed. Restaurants were not to have in-house dining for the next 14 days. And we advised use delivery or curbside pickups. We also restricted religious bodies and gatherings. And then a number of cabinet subcommittees were formed to advise on education, finance, and the social impact of COVID-19. On the 18th of March, at a post-cabinet media conference, we announced that the 68 nationals had returned from the cruise ship which was docked in Guadeloupe. All of the passengers were screened and tested on arrival. They were immediately transferred by a combination of the Trinidad and Tobago Defence Force, or Trinidad and Tobago Police Service, and Ministry of Health personnel from Piarco International Airport to a quarantine facility in Balandra. We also said that foreign nationals who are spouses of Trinidad and Tobago nationals would not be exempted to enter Trinidad and Tobago. We allowed permanent residents in. The Trinidad and Tobago Police Service or Defence Force would embark on patrols in an effort to monitor persons who have been asked to self-quarantine, because by this stage, you had a number of nationals making their way back to Trinidad and Tobago in a very hurried manner. So we had thousands of persons returning to Trinidad and Tobago, thereby increasing the risk of the importation of COVID-19. On the 19th of March 2020, at another post-cabinet, we said and announced that we would be utilizing the public health ordinance regulations to stop the opening of bars, in-house dining at restaurants, gatherings at casinos, cinemas, etc. And it was on the 21st of March 2020 that we announced the closure of our borders to all persons, including nationals. And that went into place from the 23rd of March 2020. So on the 23rd of March 2020, we restricted anyone from coming into our borders, of course, allowing certain exemptions. And that is a brief outline of the measures that were taken to restrict the importation. We're now sometime a few weeks down the road, and we've seen some measure of success by these measures, and in particular, I'm focusing today on the border. On the 23rd of March, as you all are aware, that is when 33 of our nationals made their way back from Dubai to London, from London to Barbados, and were put into quarantine in Barbados, our borders being closed. At that stage, our borders being closed, we've had nationals who are based all over the world, and we know there are over 330,000 passports being held by nationals outside there who began to make applications to be exempt and come home. The rest is really history. So the 33 nationals from Barbados had lawyers engaging the government and communicating, and eventually returned to Trinidad and Tobago on the 21st of April. As we know, they went into state quarantine and they have now been released. Thankfully, everyone was negative. We had 69 of our nationals, actually 68 nationals and one permanent resident return from Suriname on the 1st of May. So what the government has been doing with respect to our borders is protecting us against the importation, the further importation of COVID-19 into our borders. And what we've been doing is, in a very measured way, after consultation with our public health, medical experts, we've been allowing some persons to return to Trinidad and Tobago in a manner that the state and the state facilities, and in particular the Ministry of Health, can manage these persons. In the unfortunate instance, if there is an importation, a reimportation of COVID, we would be able to manage it and ring fence it. We have been receiving requests from nationals all over the world. In fact, before coming here this morning, I had requests from nationals who are now in India. We've had requests from nationals in the United States, United Kingdom, from every corner, Saudi Arabia, every corner of the globe. The government continues to protect the population of Trinidad and Tobago in a very careful manner, and we are managing the return of some of our nationals to Trinidad and Tobago. I'm here today to tell you that the next groupings that I have given permission to enter Trinidad and Tobago are, we had some workers who are in Guyana, so we've authorized them to return. They're in the process of making their travel arrangements. We are waiting the final travel arrangements to grant that final approval. That is going smoothly so far. It seems as though the vast majority of them were working in the oil sector down there. We estimate at this stage that is about 22 or 23. And then I've also begun to authorize those who've applied to return from Venezuela and Margarita. Again, the government is not incurring the cost of these persons returning. We are preparing for their return, at which stage, when they arrive, the chief medical officer and the medical personnel from the Ministry of Health will decide as to how they are handled after they're medically examined and assessed. We have also granted approval for a young lady who's in the Bahamas who reached out and was having certain medical issues. The last correspondence I'd gotten from her was that she was trying to arrange through her medical insurance an air ambulance to return to Trinidad and Tobago. The government of Trinidad and Tobago, unfortunately, cannot engage and enter in the repatriation of our citizens who are scattered all over the world. As you know, some of the other measures we put in place for our students throughout the CARICOM region is getting financial assistance to them. We continue to manage our borders, manage them very carefully, and in particular after consultation with the Prime Minister, the Minister of Health. These decisions are made. The Chief Medical Officer is always party to it. We continue to work along with our energy sector, which is one of the lifelines of revenue for Trinidad and Tobago, to also manage them to make sure that our production levels don't decline. And these are some of the steps and measures that we've been taking over the last few months, few weeks, as we enter another phase, as you've heard expressed by both the Chief Medical Officer and the Minister of Health. So the latest persons that we've authorized to come home are those in Venezuela, Margarita, and in Guyana. And that's it for me for now, Minister Cox. Thank you very much.
Thank you very much, Minister of National Security. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. And we want to give as many of you an opportunity to pose questions to us. But that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. 98.1.
Good morning again to the panel. Stephen.
Morning.
Point 1. 2 questions. One for the Minister of National Security and the other for the Minister Young. I want to address this issue again relative to mask wearing or the wearing of masks. While it is globally accepted that we all wear masks for protection against the virus, there's a strong view in the population that this can also drastically reduce face recognition of person in instances of crime fighting. Currently, there is many financial institutions, for example, do not allow persons to wear hats. I wanted to have your view on the issue of mask wearing, a mask wearing population that some of us believe have the potential of being an added security risk to law enforcement. And Minister Deyalsingh, Dr. Otello yesterday addressed the issue of mental health and the national rollout plan. But my question has to do specifically with that special focus group of 8 families who lost loved ones over this period. Apart from the psychosocial and the counseling that the ministry has been offering, is there anything else the government can do to help bring further comfort and relief in a physical way that to these family members at this difficult time who remain subjects of grief?
Thank you very much for that question. What I can tell you is the advent of COVID-19 is a lot of balancing. So it's not only balancing the economy and health concerns, but also, as you rightly identify, national security. We too have had to be balancing, and you'd see that this is a global issue when it comes to the wearing of masks. At the end of the day, fortunately, good sense has prevailed in Trinidad and Tobago, and we have, the vast majority of us, listened to our healthcare professionals and experts, and we are utilizing the mask. At the outset, I was in personal contact with the Bankers Association, Unit Trust, and some of these other places when we introduced and we suggested to people to wear the mask. And there are ways and methodologies you get around this. So, for example, one of the discussions was just ask customers as they enter the bank to just remove their mask briefly for a second, put it back on. And that way, obviously, the security. I don't want to get into the other specifics of what it is we're doing to move around this. It is something that's being faced globally. In fact, I was very disturbed as a human being to see a few nights ago a story where a security guard in the United States who insisted that people, because wear their mask, ended up being shot and killed as a result of his insistence with the mask. I am just asking all of our citizens in Trinidad and Tobago, continue to work with us. National security is doing all that we can. We're not letting anything stand in the way of our efforts to keep people safe and secure. This morning at my security briefing and meeting with the Chief of Defense Staff, the Commissioner of Police, the Intelligence Services, and their executives, we continue to focus, and there are certain things we're doing. So please keep wearing your mask. That's the advice from our public health care services. It is open to any police officer to ask you just to briefly remove your mask, put it back on, or so you can be properly identified. So we continue to work along with the advice from the Ministry of Health personnel.
Yes, and thank you for your question, Mr. Cummings. So, specifically for the type of support that the families of those 8 persons who died can get, so at the Ministry of Health, there's a range of psychosocial services that we can give them. The RHAs each have social workers, and then under the Ministry of Social Development and Family Services, there's a whole range of tangible goods and services. So we are prepared, interagency between health, the RHAs, Ministry of Social Development and Family Services, to provide psychosocial response, and through the Ministry of Social Development and Family Services, more tangible goods and services. Before I close, Minister Cox, Mr. Verne Extavour asked me yesterday about NADAP and what we are doing. I think, Verne, you were the one who asked about NADAP and the drug rehab centers. I can tell you that under the Ministry of Health, NADAP has in fact reached out and consulted with all the rehab centers that form part of the Ministry of Health's outreach program. We have implemented all the necessary protocols, including access by visitors. Some of these centers have engaged in online counseling for both their clients and families, and NADAP continues as part of their regular surveillance, but heightened now with COVID, continues to monitor and support all the drug rehab centers that it has on its roll. So, Verne, I hope that answers your question from yesterday, and thank you very much.
Thank you very much, Minister. I-95.5.
Good morning to everyone. Whithfield Turner from I-95.5. Minister Deyalsingh, that was actually an answer to my question, so thank you for that. Also, I'm getting calls from persons who are in the visually impaired community. They are saying that they feel left out with a lot that is taking place right now with regards to COVID.
Oh, visually
They're
impaired.
unable to consume a lot of the information because most of it is online and they are unable to access it in the format that it's at. So they're asking that something be done about that. And for Minister Young, persons with supervisory orders or orders of supervision are asking for guidance on how to proceed in their circumstances. Some of them would have turned up at the ministry's offices and they found the offices closed. So they're asking us to how they should proceed in order to basically keep up their end of the bargain, as it were.
So I'll take the first part of the question. So thank you for giving me that feedback about the visually impaired. And I will have the Corporation Communications Department, who is here with me now, to get on that and make sure we communicate with them in an appropriate manner. Thank you for the feedback, sir.
Thank you.
Okay, thank you very much for that question. As has been announced and a press release was put out by the Ministry of National Security a couple of days ago with respect to immigration and immigration matters, we have basically allowed a period, not an amnesty period, but an understanding period, that with certain reporting measures and certain persons who have to come into the immigration departments to renew their process, for example, applications for permanent residency, and this would include orders of supervision. Right now, you have a bit of leeway that we're not demanding it. You are going to be rescheduled. Nobody is going to be caught and said that you're in breach of your orders of supervision. That's what you asked for specifically. We are monitoring it, and you will be given new dates to return. We're looking at and waiting on the Ministry of Health when it gives its advice, when the Prime Minister makes his decision as to the next step. So right now, until the 15th of May, all orders of supervision, we continue to monitor it, but you're not required to come into immigration to present yourselves. You will be given new dates to come in and do so.
Before I move to the next media person, Whithfield Turner, I understand today is your birthday. Happy birthday from all of us.
Happy birthday.
How old or how young?
I hope you have a great day.
Congratulations.
Thank you very much. Thank you very much.
91.9.
Hi, good morning, everyone.
Morning.
Extavour 91.9. And for the CMO, are we satisfied that the contact tracing that we've done for initial local spread cases has been effective and has been contained in terms of making sure that we capture everyone in the local spread scenario? If we could get some feedback on that, that would be appreciated. And for the Minister of National Security, moving forward, we are hearing as a possibility, so it's a little bit of speculation, but we want to hear about, intentions in policy, that mandatory quarantine may be necessary for people coming into the country and coming into our borders. What do you think this would mean for our tourism industry in general, for persons who are not coming for 14 days or even 7 days? What do you think, would mean, and what would be your, position policy-wise as the minister with respect to the borders and people coming for that purpose? Those are my 2 thoughts. Good morning.
CMO.
Yeah.
Waiting on him. Yes.
So in terms of your contact tracing, I would have gotten personally involved in the last couple of cases. Just to give you an idea of the case, the last one, 116. So we're roughly about 10 or 11 days into the period post-infection, post-confirmation. In terms of that one case, we would have traced over 50 persons that would have been primary, secondary, or tertiary contacts thereafter. I am generally satisfied with the way it is done, but however, we always have this hidden contact term that we have been using from the start, and that is where the concern lies for any case. So you have the cases that you know well about, primary, secondary, tertiary, which we are doing fine. We're following all of them up twice a day to ensure that they have no fevers, no symptoms suggestive, and of course they will be swabbed if the need arises, and they're being well quarantined. So that process is working well, but there may be hidden contacts, as I described before, persons that you would have met in a cursory way. You don't know those people in a supermarket, for instance, you're using a trolley before them. Those hidden contacts are always our greatest risk, and that is why we look to 14 days to ensure that there's no further spread around a particular case and the development of a cluster.
Okay, thank you very much. You are right. Your question is, I think, a little speculative, but is an easy one to answer. At this stage, Trinidad and Tobago has been very fortunate in our management of reducing the spread of COVID-19 because the Prime Minister has led the Cabinet in a particular way. And that is that we will listen to the advice of our medical experts, our public health experts, the CMO and his professional team who have led the country very well. So that is the simple formula going forward. At this stage, it is very premature, in my humble opinion, to get into a conversation about tourism. We're taking things step by step. We need to see how things are across the world. International travel has not begun. And with respect, particularly the mandatory quarantining, you would recall that from the time we started putting in place border restrictions, there was a self-quarantine period that the CMO had advised that people who, in that rush to get home before the 22nd, I think it was over 10,000, around 15,000, 19,000 persons who came home in that very short period of time. We asked them to self-isolate. But you would have seen, as I took some time this morning going through the other persons that we've been allowing to return and they're being state quarantined. Right now, we're in a very controlled process. We have it very well managed, but we're taking the advice of our medical public health experts, and that's what we'll continue to do. We're not at that bridge yet, but long before we get to that bridge, re-tourism and how we deal with persons returning to Trinidad, I am sure we will be able to make the necessary announcements. Thank you.
Thank you very much. I just want to go back to a question from Whithfield Turner. Trinidad and Tobago Television has been providing the Blind Welfare Association with the key points from the daily press conferences for translation to Braille and circulation, and that has been happening for the past 2 weeks.
Very good.
Express.
Good morning, Camille Hunt, Express.
Morning.
My question is for Minister Young. You said the nationals in Venezuela and Margarita will be allowed to return. However, they are saying that they are unable to charter a flight because they simply don't have the money to do it. So what is going to happen to them from here? Is the government going to consider sending a flight to collect them?
Okay, well, as I had indicated when I was in my initial presentation, at this stage the answer is no. At this stage, the government cannot undertake to be sending repatriation flights all over the world. As I indicated, I have persons writing to me from Saudi Arabia, from the United Kingdom, from the United States, from India this morning. So what we've done is we've granted them permission, and you've seen it happen with other people from Suriname, from Guyana, and others finding their way back, and that is where it stands at this stage. So we have done our part, and we've always outlined from the word go that when we allow persons the opportunity to return in this managed way, it will be up to them to make their way here.
Thank you, Minister. TV6.
Hi, good morning, everyone. Lutchmansingh from TV6. My question goes to the Security Minister, Minister Young. If our borders are now so safe with there being no unauthorized entry to the country, why, or even illegal entry, why weren't these measures being done years ago to prohibit the entry of drugs, guns, ammunition? What is being done now differently? And if they're not so safe, have we seen any migrants still coming into the country through illegal means, if any?
Thank you very much for that question. I think there is a very clear distinction to be made between the illegal entry of persons across our borders via the sea and the measures that we've put in place for COVID, which is really shutting down international travel and managing entry and limited means for entry. Of course, those who engage in illegal activity are not concerned with that. What the measures have done is they've given us an additional ability in law to charge persons. So I have from time to time announced the Trinidad and Tobago Police and Coast Guard have also announced a number of measures, a number of operations where we've picked up illegal persons coming across our border via boat, and now we can charge them amongst the other criminal offenses with crossing our borders without permission. So we continue to do the work. It's been quite successful. We have not seen, thankfully, a wave of migration across our borders in Trinidad and Tobago. We have strategically placed our marine assets outside there, and they are working very well in conjunction with our radar system. Our Air Guard have also been providing support, and the Trinidad and Tobago Defense Force, the Trinidad part of which is the Coast Guard, and working with the Trinidad and Tobago Police Service have been doing a very good job. So you're not seeing this stream, and we've been shutting down a lot of these persons who trying to come across illegally outside there in the waters, and I think that signal has gone back to those who are making these attempts. So we have been doing all that we can with the borders. That has never stopped. That has never, at national security, you don't have the ability to say, well, okay, we're dealing with something else. The COVID is just an additional number of duties that we have to perform, and I'd like to really thank all of the officers who are out there day and night, and our assets are working and has been quite successful.
Thank you very much. We move to Tobago Channel 5.
Hi, good morning. Kandace Jackson from Tobago Channel 5 News. I want to ask if either one of you ministers have been able to have a conversation with our new Chief Secretary, Ansel Dennis, as yet, and what would the nature of those if you did? And in regards to the border opening, Minister Young, we still sticking with the timeline of April 15th, and if we are, do you know as yet if it be done on a phased basis? So what can we expect on April 15th?
All right, I will start. I have not had the opportunity of having a conversation with our new Chief Secretary over in Tobago, and I wish him and the whole Assembly all of the very best. I'm sure that in the coming days we will be able to have a conversation. With respect to the border controls, at the right time, as we've been doing throughout, decisions will be made and the decisions will be announced as soon as they're made. So there is going to be, as the Prime Minister told us the last time he addressed us, there is going to be a meeting where we would sit and we would decide, after taking the advice from our medical public health experts, how we're going to be dealing with the measures that are currently in place and what you've seen the international concept of rolling back some of these measures. With respect to borders, as I've been at pains to try and explain every time I've come here, and in particular this morning, your borders are your line of defense. Right now, we're seeing in Trinidad and Tobago amongst the population a fairly good control of the spread of COVID-19, no new cases within a particular time. Our health experts are monitoring it. The last thing we want to do is allow importation of new cases to flood our system. So that will be one of the major factors we consider. But as soon as we reach there, we will announce it.
Thank you. CNC3.
Hi, good morning.
Morning.
Hello?
Yes.
Hi,
Good morning to the panel. Jesse Ramdeo from
Hi, morning,
CNC3
Jesse.
News here. Minister Deyalsingh, this first question is to you with respect to the steering committee. Can you provide us with a possible time frame or projected timeline as to when you would like to see it officially established, as well as in terms of reports being submitted, and as well to the Minister of National Security, Minister Young? Government's tier 2 orders are still in place. However, there appears to still be an apparent breach by members of the public of this order. We've been seeing some increased activity. I would like to find out from you, have you noticed any increased activity on your end? And, is there some sort of cause for concern as to whether this could set the country back at this point in time?
Okay, so thank you very much for the question, Jesse. And I want to reiterate how important this research project is going to be. It will help us identify any gaps if there were. It will help us with developing our health system's resilience. It will help us focus resources for other pandemics. So the timelines are going to go like this. The terms of reference, I have given them 48 hours to develop the terms of reference. So by the 9th of this month, I think today is the 7th. So within 2 days, we should have the terms of reference. The terms of reference are then taken to the Ethics Committee at the Ministry of Health. That is chaired by the Chief Medical Officer. And I have given them 5 days to approve the terms of reference, to have the ethical approvals done. Once that is done, we set up the different heads to deliver these different papers. So, for example, one of the major papers is going to have to be the new symptomology and the clinical experience. So we have to allocate the specialists there. Another major paper, which was key to our success, is communications. Getting the population to trust communication sources, and the MFO report spoke to that. Because when you are dealing with a global pandemic, you could have the best clinical response, but if you don't have population buy-in via communications and driving behavior change, for example, washing your hands, serious behavior change. So that is a timeline we are looking at, 2 days for the terms of reference, and then 5 days after that for ethical approval, and then from middle to late next week, rubber hits the road, and we start to develop the papers, and we start to engage other sectors of society. Thank you very much for the question, Jesse. Most important.
Thank you, Minister.
Jesse, I want to ask a favor. Can you just very, very briefly repeat the direct question that you were asking me? It got lost there somewhere.
Sure, no problem. Basically, it is based on some observations made. Do you think that citizens, with the government's theatre mode that's still in place, do you think that citizens are breaching the order? I mean, there appears to be some sort of increased activity. I don't know if you would have made that observation for yourself, and whether or not you find this a cause for concern.
Okay, remember a lot throughout this whole experience, the government has really used a lot of moral and what I call common sense suasion. The Prime Minister has led from the word go saying things like a state of emergency doesn't force someone to wash their hands, because this is one of the things we're being told to do by public health. So yes, I think persons have become a little more relaxed as how they're going about their business on a daily basis. I'd like to use the opportunity to thank the Trinidad and Tobago Police Service, Defense Force, Fire Services, all of the officers, the frontline health workers, for the tremendous job they've done in guiding us through this period. I don't have a real cause of concern. Every morning when we have discussions at the security table, it's one of the things we talk about. there have been instances of persons trying to bend the rules, persons trying to interpret it in all different sorts of ways. Unfortunately, that is part of our society, and unfortunately, some people just like to try and find a way, but I don't think there's any cause for concern. I mean, some of it is comical at times with, persons buying bread, putting it in their shop and calling themselves a bakery, a store, saying, well, I'm having discount on my clothing items, so I'm a discount store, and these types of examples. At the end of the day, we've done the best that we can to continue to keep people safe. I think the vast majority of Trinidadians have adhered to the advice to stay at home. We are going to enter that period, and the Prime Minister will make the necessary announcements once we've made decisions as to how we begin rolling certain things back. I think we've done well to get where we are. If necessary, we at National Security will do all that we call upon by the Ministry of Health experts if we feel as though there's a runaway situation and that is going to lead to some spread of COVID-19. We will do what needs to be done to hold the breaches together.
Thank you, Minister. Power 102.
Good morning, Head Table. Kimberly Desouza from Power 102 and ESO Media.
Morning.
My question is to Minister Young. Minister, I just wanted to get an update on the prison population. I know that you would have been working with the Attorney General and other organizations trying to identify which inmates we could release from prison or on remand. Just wanted to know if that figure has increased, because the last figure we had was 121. Also, Minister, can you tell us if there's going to be a monitoring system, or do you think there's a need for a monitoring system? Because I know when these prisoners are released, more than likely they will be going back to their communities. Thanks.
All right. As you are aware, that is a program that has been driven by the Attorney General. So I don't have the exact numbers with me here today, and I don't want to go to my phone to interrupt the smooth flow. What I can tell you is the first set of prisoners that would be released are the ones who are just in there for simple breach of traffic orders and maintenance. We've been very, very careful in the selection of those prisoners. So they are low-risk prisoners. They are ones who they don't pose any real threat to society. They've fallen in breach of not paying a maintenance order, not paying a traffic ticket on time, etc. So those won't fall into those that we would need to use monitoring. We're trying to push through the electronic monitoring system, which I hope to do shortly, but the priority of that is going to be on domestic violence and other prisoners for terms of bail. So right now that process continues. I can speak to the ones that come before the Mercy Committee. It's quite a large number. Over 700 names have been put forward. I chair the Mercy Committee. The Mercy Committee is a constitutional body under Section 87 of the Constitution. We will make the necessary recommendations to the President. I'd ask for legal advice because there's certain Privy Council decisions that mandate how you go about determining these cases. And they say that each prisoner has to have a hearing. They have to be told what material is before us, etc. So the Attorney General's office is working feverishly along with the Ministry of National Security for us to try and come up with a process where we can deal with these over 700 persons. And you can also release on condition. So some of them may fall into the category we'd want to monitor, etc. As soon as we have more information, we will make that information available to you all.
Thank you very much. The CMO recently spoke about new normal behavior, and there's a question concerning what is the gym protocol going forward. Could the CMO tell us, what are his thoughts on the gym protocol going forward? A lot of persons have been asking about the use of the gym.
Exercise home?
Yes.
Right. So you would have seen Dr. Rahman go into some depth a few days ago with regards to the protocols that are being developed. Yesterday, I received the draft document in my office. I had a few queries related to being more specific to the use of masks. However, that document should be completed by tomorrow. We are working with the chamber. Specific to gyms, what we're looking at, of course, is entry screening, one, ensuring that you're not ill before you come into the space. We would look at frequent sanitization of the hard surfaces. It may be difficult to wear masks, but we're looking at social distancing within the spaces. Sanitization is a key one. Maybe between use, there may be some role for people to sanitize the equipment between actual one person and another one using it. Whether that is done by the person utilizing the gym or staff, that is to be determined. But there would be some hand-holding from the Public Health Inspectorate side directly with the owners of such establishments if and when they are to reopen.
Thank you very much. Yolande Thomas.
Good morning, Yolande Thomas from Caribbean Lifestyle Communication.
Morning.
Good morning.
Morning.
This first question is for the CMO. I know he stressed patient confidentiality, but the final patient who is at Hoover, can he provide us with an update as to their condition if it's possible? And the other question is to the Minister of National Security, if he can weigh in on the case that was closed with respect to Christopher Wiley.
So in terms of the patient, all I can say is what I said this morning. She's basically in the high dependency unit. All other information will be given to herself as well as her family.
I will be equally short as the CMO was. The Wiley case certainly doesn't enter the COVID conversation,
Exactly.
and it is not something that I will be commenting on at all. Thank you.
Thank you, Minister. ACP News.
Hi, good morning, Friar Bihari, ACP News.
Good morning.
Minister Young, I just wanted to get you involved in this question. A tenant says his landlord doesn't want to provide him with the documents to get the rental relief grant, and he's been threatened to be evicted. He wants to know what can he do. And at the other end of the spectrum, there may be a lot of landlords who have not for years declared their rental income. I don't know if you could just give us some sort of advice on this.
I could answer one part of that question on behalf of Minister of Social Development. The tenant is supposed to send in their last receipt and also send the landlord's name and number while filing.
Thank you very much, Minister Cox. I was wondering if prior expected me to put back on my legal hat and render legal advice. So you've heard how the approach is from the government with respect to that. Unfortunately, we know there are a number of cases, and I fully endorse what Minister Cox has just said, because that is the government's position with respect to it. With respect to landlords who have not been declaring their income, as you know, right now the Senate has passed the Trinidad and Tobago Revenue Authority legislation. It will be coming to the House shortly. And this is one of the areas that there is a level of concern at a governmental level. You don't want leakage of revenue, but certainly that should not be what is driving landlords to put their tenants in a difficult position at this stage.
Thank you. We move to Newsday.
Good morning, everyone.
Morning.
Gonzales from Newsday. I have two questions to the Minister of National Security. My first question is about the 2 Cape-class vessels for the Coast Guard and the 2 fast ferries, which are due to be delivered from Australia shipbuilders Khrystal and Incat in mid-2020. I'd like to know when will these vessels be delivered, given the global COVID-19 restrictions. And my second question, Minister Young, you said arrangements are being made for TT nationals from Guyana and Venezuela to be allowed to come home. What consideration has been given to TT nationals stranded on cruise ships?
Okay.
Thank you.
Thanks a lot. The answer with respect to the nationals stranded on cruise ships is there's ongoing consideration with respect to it, as I've been at pains to state this morning. This is a process that has been managed by the government with one main mantra driving our decision-making process: protect the population of Trinidad and Tobago in Trinidad and Tobago. And that will continue to drive our decision-making after consultation with our public health experts. So right now, it is hundreds of persons who are on these cruise ships. We are very aware of it. It is actually something that is confronting a lot of CARICOM nations, but our position remains at this stage: shelter in place. All of these cruise ship workers are being, as far as we being told by the cruise ship companies, are being looked after by the cruise ship companies, and that is the best place for them to be at this stage. So right now we are focusing on, as I've said this morning, the nationals have returned from Barbados, from Suriname. We've given the green light for those in Guyana. We've given the green light for those in Venezuela, Margarita. With respect to the Cape-class vessels and the 2 fast ferries, I got a briefing on the Cape-class vessels this morning, and in fact got some great footage, video footage of the ferries being built down in Australia, and they are proceeding according to plan. We're hoping to get the first fast ferry delivered. I think the date is sometime in October of this year. With respect to the Sorry, that's the Cape-class vessels I was talking about. So I've seen videos of the Cape-class vessels. I continue to get reports from the Coast Guard through the Chief of Defence Staff, because we have some TTDF officers down in Australia. So those are on course for delivery and coming along quite well. The fast ferries as well, one is being built by Ostal and one is being built by Incat. As far as I am aware, they continue to be around the same estimated date of delivery as before. There may have been a fall off of a few weeks due to the COVID, and then you all would recall there were some wildfires that were taking place in Australia sometime last year, and I believe the delivery date for the first fast ferry continues to be at the end of the second quarter into the third quarter of this year. But we don't have the exact date. Things are just very fluid, but they continue to be so far according to plan.
Thank you, Minister Young. While you're at it, there's a question here concerning persons who travel to other countries. For example, Margarita, I know 2 persons who are in Khrystal and some other places, and they are asking about, how are they getting back? I believe it has to deal with flights and who is paying for those flights.
Thank you very much, Minister Cox. As we've been telling persons, there's 330,000 nationals of Trinidad and Tobago who are out there with passports. Persons, when we're giving consideration to the applications being made, I am getting applications on an hourly basis from persons all over the world. When the time is right and we're ready to give you the green light to return home, it's up to you. Unfortunately, that's just the way it is right now, that you're going to have to find a way to make your way back home. So far, persons have been able to, whether it is they're able to charter flights and this type of thing. But at this stage, the government certainly is not in a position to have any repatriation flights.
Okay, thank you. Astrenut Health.
Gweneth Stuart, Astrenut Health newspaper. Good morning, everyone.
Morning.
Morning.
My questions this morning are from concerned citizens relative to health issues. Someone urgently needs a tooth extraction and has repeatedly approached Mount Hope and been told that the procedure isn't being conducted at this time due to COVID-19. So why has COVID-19 halted such procedures and how soon will they resume? And from a parent whose child has Kawasaki disease, which generally affects children under 5 and is now being linked with COVID-19, are we in Trinidad medically prepared for a rise in Kawasaki in terms of sufficient medication and treatment in general? Minister Cox, if I may, I'd like to comment on a question I had asked earlier this week about a senior citizen. There was a response, and I don't know if...
What do you have? Is it a question or...?
It's a response to the question that may help other senior citizens who have...
Well, you could send it privately. Okay? Thank you very much. CMO?
Yeah, so in terms of the question related to Kawasaki disease, I think we have seen a number of cases in Trinidad over the years. It's a very uncommon type of disease in this setting, but the pediatricians, I think, are well placed to manage it if it does occur. The research based on COVID is fairly new as it relates to this clinical picture. We have had limited experience with it and haven't seen any presentations thus far out of the cohort that we had in Trinidad. In terms of the dental extractions, I can look into it through our dental manager to see what is happening at Eric Williams and other facilities, but they are supposed to be managing their emergencies as per usual.
Thank you, CMO. TTT?
Good morning, Khrystal Wilson from TTT Limited. A question for the National Security Minister. The last time, might not be the last time, but you were here previously and you mentioned something about the passport office being closed for about a week for a system upgrade. Can you confirm for us whether or not that has been completed and whether or not operations have in fact resumed?
Thank you very much. The answer is yes. Fortunately, they were able to upgrade the software and the hardware at Immigration Office with respect to the passports. They have resumed passport appointments on a sort of phased basis because, of course, we still don't want a mad rush and we don't want people falling foul of all of the social, here is now physical distancing and these other measures. So I had actually asked that question this week that I want a written report from Immigration as to how we're going to go into the full-phased implementation of resumption of passport appointments for renewals, new passports, this type of thing. We've been suggesting going on an alphabetical basis, and it should be a lot easier. There have also been discussions going on with TT Post to see how we can deliver these passports rather than have people come in to collect passports, and also looking at being able to take the money online. Right now, you can use your links at the passport offices, but we also want to move towards the online now that we've upgraded the system. So all of this is taking place during this period of time when things are a little quieter, and we will continue to keep the population informed.
I just want to supplement the question on Kawasaki disease, not from a clinical perspective, but from a policy perspective. One of the papers, the first paper I spoke about that the Ministry of Health has to engage in research is the clinical experience due to the new symptomology. And we mentioned silent hypoxia. We are also going to be looking at Kawasaki disease, and then you also have to look at a new phenomena called COVID toes and COVID fingers in the pediatric population. The bigger countries that have thousands of cases are now reporting that children develop something called COVID toes and COVID fingers, where you see the toes and fingers turn red. And it seems to be a sign, an early warning sign. So the research that we decided to start to do this morning, that research, Gwendolyn, is going to be so critical moving forward in how we define COVID, what will be the case management definition. And you have raised a very important point, not only with Kawasaki, but with silent hypoxia and COVID toes and fingers in children. And that is the purpose of our research now. Thank you very much.
Thank you. Just want to go back to the CMO. There's a question here. The WHO confirmed that retesting has shown an early case of COVID-19 being found in France. Will government reconsider retesting samples here to ensure that COVID was not around before? CMO?
Okay, so in terms of our COVID testing in this part of the world, we began in Trinidad. Our first COVID test was done through CAFA on the 7th of February. Between the 7th of February and March 12th, when we had our first case, we had already done 52 tests. Prior to that, we would have been doing tests for 14 pathogens, respiratory pathogens, as a normal through CAFA. So samples would have been taken. What we were picking up prior to that was H1N1 to the most part, some type B and type A, as well as some other common respiratory pathogens. So I think we were in a good place to determine what was circulating in the country in terms of COVID, even up to February 7th when we actually began testing.
I want to thank you, the members of the media, the viewing and listening audience, Minister of National Security, Minister of Health. Ladies and gentlemen, we have come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. We cannot stress enough the importance of relying on these sources for the information on the pandemic. Unreliable and false information about COVID-19 is spreading so fast around the world that some have described this problem as disinfodemic. We recognize that not everyone who shares false information is doing so maliciously. We also recognize that misinformation happens online and offline. Regardless, the effects are the same, and the long-term implications are seeds of division, mistrust, confusion, fear, anxiety, and poor decision-making. We cannot allow the prevalence of false information to destroy our beautiful country, which is why we are pleading with you to think before sharing. Please be critical of the information presented to you online and elsewhere, and we will continue to do our part to ensure transparency and timely disclosure of information. We are asking you to rely on the Ministry of Health and the Ministry of Communications for information on COVID-19. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.